Good morning or good afternoon now that it's noon, everyone. Thank you all for joining us. I see our attendees are jumping on the call, so we're going to give everyone about 2 minutes to jump on. We are also recording this and streaming live on the Herizon Facebook page so that it can be viewed later and shared. Feel free to share it on your own personal Facebook pages and to your network as well. We'll start right around 12:02 p.m. Good afternoon again. Thank you all for joining us today on this timely panel about the cost of being a woman. I am Holly Caratinudo, Grants and Program Manager at Herizon. Over the past 20 years, Herizon has been working to advance the status of all women and girls right here in Palm Beach County, across the state of Florida, and in Israel. More recently, we have focused on economic empowerment and security for women and girls. Today, we will focus on the costs of healthcare for women. We've brought together local experts to focus on the costs of missing preventative care, the cost of not having health insurance, and the cost of changing legislation here in Florida. As we will focus on the financial costs today, I want to take a minute to remember the emotional costs of healthcare for women. According to national data, about half of women report worsening mental health since the beginning of 2020 or the start of the COVID-19 pandemic. In addition, caregiving is still commonly perceived as women's work in the United States. AARP noted that caregivers face the loss of income of the care recipient, loss of their own income if they reduce their work hours or leave their jobs, loss of employer-based medical benefits, shrinking of savings to pay caregiving costs, and the threat to their retirement income due to fewer contributions to pension and other retirement vehicles. Caregivers are at higher risk for stress-related illnesses, and their rate of depression is 2 times higher than the national rate. 67% of caregivers report not going to the doctor because family needs must come first. I am very grateful that our panelists have joined us here today to have an open discussion about some of these financial and emotional burdens. Amy Weintraub from Progress Florida had planned to be with us today. However, due to the unprecedented move of Senate Bill 300 to the floor today, she is unable to join us as her focus is in Tallahassee, along with many other people. I am grateful that Jessica Hayden from Emma agreed to join us last minute. I would like to give each of our panelists a few minutes to introduce themselves, and I will start with Jessica.
Hi, thank you for having me. I'm Jessica Hayden. I'm the executive director for our local abortion fund in Palm Beach County. Our name is Emergency Medical Assistance. We have been around for over 50 years providing financial assistance to people located in the Palm Beaches and Treasure Coast so that they can get their abortion procedures, as well as covering practical support costs, which includes hotel, flights, gas, food, Uber, and Lyft. I have been with Emma since September, and I am a grantee of Herizon, which has been a huge, huge help for our organization. As she mentioned, the costs have just been exorbitant in covering people's procedures and their travel.
Thank you, Jessica. We are so grateful for our partnership with Emma and being able to support your organization. I would now like to introduce and let her introduce herself, Karen Patty from the Promise Fund.
Good afternoon, everyone. Thank you so much for having us today. My name is Karen Patty. I'm the Chief Operating Officer at the Promise Fund of Florida. And really, at the Promise Fund, our mission is to end deaths from late stage breast and cervical cancer. So we know that if caught early, breast cancer is 99% curable and cervical cancer is 95% curable. So really the question is, why are so many women still dying from these diseases? And the answer is really lack of access to care and services, and also a need for significant increase in health literacy and for women. So I'm excited to be here today and to share more, and I'm looking forward to our discussion.
Thank you so much, Karen. Karen and I met through Herizon about 2 years ago when we went through the Young Leaders Society. So it's always great to have you back, Karen. And now I will let Tammy Jackson Moore, Guardians of the Glades, well known in our community to be an advocate for women, introduce herself.
Thank you so much, Holly. Again, I'm Tammy Jackson Moore. I am the co-founder of Guardians of the Glades. And the Guardians of the Glades is an advocacy organization that advocates on behalf of the residents in Belglade, Pahokee, and South Bay. And we're hearing a lot of conversation from people in the community relative to the health care of women. And what's so beautiful about this is I serve on the board of commissioners for the Palm Beach County Healthcare District. And we're working very, very carefully to make certain that services are provided in this community just as they are on the East Coast of the community. So I am so happy and appreciative to be a part of this conversation.
Thank you, Tammy. And I think we'll jump right into exactly what you're talking about. Some of the gender differences in healthcare costs is due to the exorbitant cost of maternity care, including pregnancy and delivery. The average cost for delivery alone is staggering. According to Health Affairs in 2015, out-of-pocket spending for women with employer-based insurance, again, this is women who actually have their own insurance policy, was around $4,500. In one section, our rural western section community of Palm Beach County, healthcare costs also include transportation to offices and hospitals that no longer exist in this community. Tammy, can you provide some information on specific costs to women in this part of our community?
Thank you so much, Holly. Again, our community is so far away from the East Coast, but we find that there are several women in our community that need to access those services on the East Coast. So when they have to access services outside of their community, they take on an additional cost, and that additional cost can be for transportation. A lot of people in our community are transportation challenged, so they must rely on the public transportation system, which means that if they have a 10 o'clock doctor appointment, they may have to leave their home as early as 5, 6 o'clock so that they can make that 10 o'clock appointment. That removes them from the community. It removes them from their family. It removes them from their children. They have to make certain that they have care available for their children while they're away from the doctor. It just compounds the issue of having to see a doctor, and then you have all those other things that you're worried and concerned with at home. So transportation is a big piece here in our community. So what we try to do is make certain that those services that are offered on the East Coast are offered out west as well, so we can eliminate that barrier to access for healthcare.
Jamie, just as a follow-up, are there certain services that currently the Western community is not able to access and needs to come east, and things that you would look for that should be provided out west?
While we have several doctors here in our community that provide services, those specialty care services may or may not be available here in the Glades area. So people are forced to go outside of the community to receive those services. So another thing that we do is we no longer deliver babies at our hospital. We don't no longer have an OB ward here at our hospital. And that's because a lot of the women, they had opted to go outside of the community to have their baby. So when you opt to leave your community, you are setting a precedence to remove services that are already provided in your community. So if we have the women that stay in our community for that care, we can continue providing those services. And we're talking about quality of care. And we want to make certain that we have quality healthcare services available in our local community.
I know a few years ago, a large mental health organization closed in your community as well. Do you still feel the effects of that?
Absolutely. We still have people that are challenged with receiving the support that they need as it relates to mental health. We have people that have to go outside of the community for their mental health care. Although we're trying to bring them back home, they just continue to go outside of the community because of several reasons. One of which they're uneducated about what's available here within the local community. So we in the community have to do a better job with marketing those offerings that we have right here in our local community and making certain that people know that they're here, they can get these services right here where they live, work, and play.
Yeah, and I think in general, Palm Beach County, most of the residents have no idea about the Glades and the wonderful community that exists out there. So I'm so grateful that you're able to come on this call. I always talk about the first time that I went out to the Glades and I was getting driven around by a coworker from Victim Services, and we drove over this bridge and came to this body of water, and I said, "Oh, does this connect to Lake Okeechobee?" And she was like, "This is Lake Okeechobee." And you forget that Palm Beach County literally goes all the way to Lake Okeechobee, and that is still part of our community. And we want to make sure that the residents of that community get all the services that they need. And like you said, that they don't need to leave the community to access the services and all of the risks and consequences, especially financial consequences that come with having to leave the community to access those services.
Absolutely, Holly. We thank you for this opportunity to really, really talk about our community. We have a beautiful community, it's very close knit, and we are indeed a part of Palm Beach County. And we, being the guardians of the Glades, want to make certain that people know about the history and the wealth that we have here in our community.
Great, thank you. One recent survey showed that 45% of women went without access to preventative screenings, checkups, or vaccines in the past 12 months. I am guilty of this. I had not scheduled my own physical for over a year. And because of this discussion, I literally went and called the doctor and scheduled my own physical because I've just been so busy and had so much going on. And I'm a caregiver of my own children. Their needs come first. And for a quarter of the women who were surveyed, they said that cost was the biggest barrier to care access. Karen, you're from the Promise Fund of Florida. Could you discuss how missing preventative health care may have long-term negative consequences for these women?
Yeah, thanks, Holly. I know so many people, especially because of COVID, missed their screenings, and it was estimated that I believe 80% of women fell behind with their mammography screenings, due to COVID. So I know it's time, and I hope that everyone will catch up. But in Palm Beach County alone, it's estimated there are 80 to 100,000 plus women who are uninsured. So in addition to all of us that may be behind, there are many women who may feel like they not have nowhere to go for preventative care. And we know that accessing preventative care reduces risk for diseases like cancer, diabetes, heart disease, stroke, osteoporosis, oral and dental conditions, mental health conditions, and disabilities, and ultimately even death. So, teaching individuals the importance of preventative care and shifting from sick care to well care is so important. So just to use the Promise Fund as an example, we really focus on people and relationships. So our mission of ending deaths from late stage breast and cervical cancer is achieved by utilizing patient navigators that work throughout our entire Palm Beach community, in every corner of the community, to help women gain access to healthcare, find a primary medical provider in a medical home. Many women don't have a regular doctor. Obtain screenings. You're going to get those prescriptions for the breast and cervical screenings, and we help them overcome any barrier, no matter what the barrier. Like Tammy said, many times it's transportation, could be financial, could be childcare. We just had an individual that was reluctant to go to a preventative care check, and the navigator found out that she didn't have housing. So we were able to address that first, and then everything will fall, and we can help our patients and participants get everything together so that they will enter the medical system and obtain the preventative care that we need. And in addition to the financial piece, it's really been studied and researched that the number one reason why women aren't receiving the regular screenings for breast and cervical cancer is health literacy. So a recent study by our US government yielded that only 14 people are proficient in health literacy. So it's important that we educate the women in our community. And again, like you said, Holly, ensuring women put themselves first, because without that woman, that's going to affect so much in their lives, their families, their children, maybe even their own parents. We need to ensure that women understand the guidelines for preventative care, and with breast and cervical, the guidelines for breast and cervical early detection screenings. And I think also what Tammy said, making a greater effort to market the services that exist in the community, and making sure that women know that regardless of their ability to pay, they still can access preventative care services. There are a lot of free clinics and federally qualified healthcare centers located in Palm Beach County that accepts patients who are uninsured and underinsured, and they will work with them on providing the care that they need at either little or no cost to the patient.
Thank you so much, Karen. And I think it goes to, they always talk about, there's an example of how women put others first. When you're on the plane and they tell you that you have to put your oxygen mask on first. Well, what you see on planes is that women often turn to the side and are helping the person next to them put the oxygen mask on. But if you don't ever put your own oxygen mask on, you can't help anyone else. And I think the same goes for our healthcare. If we don't take care of ourselves, we can't help anyone else in our lives. So as much as we want to be caregivers and help our neighbors and help our friends, we need to make sure we're taking care of ourselves. You also mentioned that someone that you had worked with through the Promise Fund, or one of your patient navigators, needed housing. And there was a comment through our question and answer when Tammy was speaking that, the closest maternity ward is about 35 miles from the Glades, and many health services are not provided in the Glades, and they need quality health services, food, and lodging. And I think it all goes hand in hand. If you don't have access to those basic needs like food and housing, then your healthcare kind of isn't even a priority at that point. And so making sure that, people have access to all of those basic needs as well, and then following up with the healthcare. The other thing too, is that Palm Beach County right now has just seen such an influx of new residents. And I see it all the time. If you're in a mom's Facebook group, you see these women asking, recommend, what OB do you go to? What doctor do you go to? And I think a lot of times what people are running into is that doctors aren't accepting new patients. And, we really need to do a better job of marketing who has availability and what services are out there. And, if we need more service providers in our community, knowing what those service providers are, because we've had such a population growth over the last few years, I'm sure there is a need for more services as well.
Oh, absolutely. And I think, we run into that with cancer care in Palm Beach County. We do have resources available, but for the very, specialty care providers like an OBGYN oncologist or a radiation oncologist, breast surgeons, there aren't, there just isn't the volume of providers, you're right, and in specific service areas. And it's across the board. It's not just cancer, but you're absolutely right that additionally, I think also a compounding factor is, changes in health insurance just in general. If, Medicaid merges with another company, and some individuals lose their coverage and have to find another plan, quite often maybe the new plan isn't accepted by their current provider. So I think too, it's just important that, individuals realize that there is help out there. Our patient navigators can always help people connect with the services that they need. I know Guardian of the Glades has amazing resources for helping individuals connect with the services that they need. But again, it's raising the awareness in our community of the services that exist. So that's why, talks like these are so important, because it gives people the opportunity to learn more about what services are available.
Thank you
Holly,
so
this is
much.
Tammy, if I can, please.
Yes, absolutely.
I think that Karen, she hit on something that's so critically important. And it's important that we as women have a medical home. We need to establish a medical home. When you have a medical home, you have that relationship with your doctors, your nurses, maybe a social worker that can help you navigate some of the services. You might not know what exists in your community, but when you have a medical home, that medical home will help you navigate. They will educate and inform you of what is available. And as she mentioned, we have some very, very good FQHCs, federally qualified clinics in our community. And we're seeing those numbers begin to increase for those patients that are visiting those institutions. And we want to keep that happening. But I think it's so critically important that all women have and establish a medical home.
Yes, thank you so much. And I couldn't agree more. And again, like I said, when you move into the community, it's kind of one of those last things on your list to do, but it's such a priority is to find a doctor and a medical home that you can trust and have a conversation with that can help you find services that are going to meet your needs.
And I think just to jump in there one more time, I think what was really interesting, the CEO of one of our local FQHCs, Found Care, we were having a conversation, and he said quite often when he gets one patient that, a mom that may come into his center, she's able to not only obtain a medical home for herself, but then once she becomes comfortable, she's going to bring her children. There's pediatrics. They're going to be connected with dental. There's dental on site, mental health services. Then maybe her parents will come and other family members. So it really turns into, like Tammy said, building trust, and it almost becomes multi-generational. So I think, the impact of just one person connecting with a medical home can impact an entire family once that trust is gained and they realize the positive experience that they're going to have receiving preventative care services.
That's another great example of as women as caregivers, when they establish that medical home, they're more likely to bring those that they care for, elderly parents, friends, into that medical home as well. And so again, it's kind of the impact of making sure that women have access to healthcare. So this year, reproductive justice has become a very hot topic here in Florida and throughout the country. Currently, Florida has a pending bill that I spoke about a little bit earlier being voted on that would create a 6-week abortion ban, even though recent polls showed that 56% of Floridians say abortion should be legal. Abortion access is a nonpartisan issue that affects women's health and well-being and their economic mobility. Jessica, could you share the work that you're doing, and can you explain how further restriction of abortion access financially impacts women here in Florida?
Absolutely. And I actually want to back it up a bit. A year ago at this time, abortion was still legal in Florida up to 24 weeks. We did not have any type of mandatory 24-hour waiting period or those types of hurdles that you'll see in other states. And Florida was known as being a haven in the South for many other Southern states that had further restrictions to be able to come here and get the quality care that they need. As of July 1 last year is when Florida adopted the 15-week abortion ban and a 24-hour mandatory waiting period. And to piggyback off of what Tammy was sharing, when you do have folks coming in from the Glades needing to travel east for care, that is requiring them to come twice to that appointment. So that is lost wages, that is the cost of childcare, the cost of gas, and a lot of people don't necessarily have jobs that give them PTO. So that's one aspect of it. What has happened this week, which is on the fast track, we have Senate Bill 300 and House Bill 7, their companion bills. And this is going to limit Floridians' ability to get an abortion up to 6 weeks. There will be a rape and incest exception, which will go up to 15 weeks with what they're calling credible documentation that is something that has happened to you, which clearly creates additional barriers. That's going to require police report, potentially a restraining order. They keep that type of language loose also intentionally. I don't know if anyone on our call is an attorney or has experience with the legal system, but both rape and incest are felonies. And generally it takes longer than a year, which is obviously longer than someone's carrying to prosecute. So to make individuals have to go through all of those hurdles prior to even being able to receive, again, safe quality care that they need is egregious. The timeline for this is also a little bit unclear. The state legislators kind of broken some of their own committee hearing rules this week. This was originally supposed to be heard last week, which is why Amy Weintraub would have been here. And that got jumped ahead, and there was a hearing today in the Senate. We are expecting this to pass. Our 15-week ban is being challenged. We know that the 6-week ban will be challenged as well, because Florida state constitution does have the right to privacy protected, and those protections actually take it further than Roe did. So we have a lot on our plate. Even with the 6-week ban, we will still be paying for Floridians' procedures. We will also continue to pay for Floridians to leave the state and get care elsewhere. Like I said earlier, those costs are going to increase because a lot of individuals do not know that they're pregnant at 6 weeks. You're talking about really only missing one period. And if you don't have regular periods, that can impact it. So already, just with the 15-week ban, emergency medical assistance has seen a 300% increase in our total cost to help individuals. Some of that has also come from the fact that even at 15 weeks, we have still been supporting individuals from other states coming to Florida seeking care because some other southern states have either full bans or 6-week bans. So the cost is heavy for Floridians. The cost is heavy for the South. The one positive I'll say is that we're not the first people that this has happened to. There is infrastructure there. There's a roadmap, and we have good working relationships with the other Florida abortion funds, as well as other abortion funds across this country. This is not a sprint. This is a marathon, and I've been training for that. So thank you.
Thank you, Jessica, for going through all that with us. You know, I spent my first 5 years living in Florida as a sexual violence advocate. So I can speak very clearly to the fact that most victims do not seek law enforcement assistance. Most victims do not seek victim services. They do not have a rape kit examination. They do not get a restraining order. They suffer in silence. And so therefore, if they are needing to terminate the pregnancy that is a result of sexual violence, they are most likely not going to be able to do that under SB 300. So that is a very scary situation for anyone that has experienced sexual violence, who works in the field. I don't think that anyone who has never been working in sexual violence understands the amount of sexual violence that occurs on a day-to-day basis, and that these individuals are suffering in silence and not getting the support that they need. So that I think they're trying to make it seem like it's a better thing to have this in there, but it's really not helpful in any way. You know, and I also spoke to a gynecologist a few weeks ago. I went to a presentation and I brought up the fact that this was being kicked around, that there may be a 6-week ban coming down. And this doctor was flabbergasted and said, you know, I can't even order genetic testing until 8 weeks. And, you know, medically, you know, that women are going to be suffering medically due to this as well. So there's economic, emotional, and psychological effects to this. So thank you for sharing that, Jessica. I think it's also important to recognize that most women who have abortions are already mothers. And so again, that caregiving piece is very important to talk about. We're going to go to Tammy now. Women of color are still more likely to be uninsured than women overall, leading to delays in seeking healthcare or foregoing care altogether. What sort of programming does the healthcare district here in Palm Beach County provide? I know we talked about some of those programs already that may encourage women who may be underinsured or uninsured to seek medical treatment.
Thank you so much again, Holly. The healthcare district provides a myriad of programs, but one of the programs in particular that I'm really excited about is the opportunity to receive quality care on a sliding fee scale. There's also an insurance program that people can apply for, those that primarily fall between the gaps, that they can apply for so that they can have a certain level of insurance to receive the care that is available to them and the care that they need so that they can remain healthy and continue on with a lifestyle that is such that they can be contributing factors to society. So there are a lot of things that are available within the healthcare district space. There are a lot of things and opportunities available within the community. But again, I think we need to do a better job with marketing and educating people about those things that are available. And how do we do that? We get out and we have general boots on the ground conversations with people, meet them where they are, and share that information to them. If we have all of these programs available, but people don't know about it, it's all null and void. So we need to do a better job with communicating what's out there, what's available, and how do you access those things that are out there.
Yes, thank you. I always say Palm Beach County is very rich in services, but the fact that people don't know about those services is the missing piece. Thanks to healthcare law, women have coverage for critical health services like maternity care, prescription drugs, and chronic disease management. And the law provides no cost coverage of contraception, breastfeeding supplies, and well women visits. Karen, this is a similar question to you. How do we raise awareness about these no cost services for women?
Thank you. As I stated previously, I think we really need to work together, much like what Tammy was saying, to educate the community on the services that exist. At the Promise Fund, using our organization as an example, we conduct significant outreach and education in the communities that we serve. So our navigators are multilingual, which I think is really important because they are utilizing the language that our participants feel most comfortable speaking. It's estimated that nearly 20% of people in the United States speak in a language other than English at home. So I think it's important to take that into consideration. Also, it's estimated that, at least we have over 60% of racial and ethnic minority patients over the age of 18 that believe it's important to visit a healthcare provider, but also more importantly, that they want to be seen by someone who shares their culture. So I think when we are marketing services in the community, it's really important to take cultural considerations into account when educating. So, our navigators are just one way of connecting and increasing knowledge of these resources. But I think as professionals, it's important that we collaborate as well and gain updated knowledge of all low and no cost resources in the community. Last October, we actually hosted a community health summit to bring together local nonprofits to highlight the need to collaborate, to raise awareness of the resources in our community, to really improve the overall health and well-being of our neighbors. As a result of the summit, the Promise Fund, along with other nonprofit organizations in the community, have written a collective grant which will focus on health literacy and increasing awareness of the importance of early detection and screening for breast and cervical cancer, but also it will provide us with the ability to share resources that exist which target all social determinants of health. So everything we've been talking about today, from transportation to food to housing to childcare, to health literacy resources. So we're hopeful, obviously, that our grant proposal will be accepted, but I feel like this type of robust collaboration is needed to help spread the word. Working together collectively is more effective than working alone. So I think it's important that we team up and share all the incredible resources that are available in the community, because once you just scratch the surface of chatting with some leaders of local nonprofits and organizations, you're going to find that there's so many incredible organizations that exist that address all social determinants of health.
Yes, I think the collaboration is key to ensuring that, we all can't serve everyone, right? We all can't meet the needs that everyone has. And so we need to understand what other organizations are out there to meet those needs. You talked about having patient navigators that, are bilingual. What languages right now is the Promise Fund able to work with and provide services for?
Right now, our navigators speak Spanish and Creole, Haitian Creole. So they're working in communities that, have a larger population of either Spanish speaking participants or Haitian Creole speaking participants. And they're able to, can you imagine, trying to understand medical jargon and honestly, these forms that I have a challenge understanding half the time. It's like filling out a tax return. Um, you know, how you try to interpret that if it wasn't in your native language. So I think those are really important things to consider. Is the comfort level and the ease of communicating in your own native language with somebody when you have to talk about very complex, often medical issues. There might be immigration paperwork that you're working on filling out with somebody, enrolling them in health insurance, Medicaid forms, or pages and pages. So having somebody that's available that can help and help you get through the paperwork and kind of the logistical end, I think is really important. And I think also having someone that understands your culture is also important, and being sensitive to individuals' beliefs regarding the medical system or regarding different aspects of their lives in general, and being sensitive to that, I think, is important. And I think it's also important that our messaging is meeting the level of the patient where they are. Like I think Tammy, talked about meeting people where they are. I think that's important.
Also, Holly, if I can, I think it's also important that we make certain that when we're having these conversations and conducting outreach, we need to make certain that we have navigators that are from the community that we're trying to infiltrate and get information in. I think people are a lot more comfortable with people that they know and that they see on a regular basis, and they're willing and more able to open up to those individuals if they have a relationship with them already. So when we're talking about navigators and assisting people, I want us to do what we can to make certain that those navigators are from those individual communities that we're trying to work within.
And I think, one great takeaway from our patient navigators is, the individuals that have been navigated through, a cancer journey with our navigators. Our navigators stay with the patient. If they are diagnosed with cancer, they'll stay with that patient through the duration of their treatment and years beyond. But at the end of that, time of the treatment, we never hear from the patient anything about the cancer. We just hear about the relationship that they have with the navigator and how that person's become a part of their family and how grateful they are to the navigator. And it's almost, that person has become their rock, during this time. And I think creating those strong personal connections does develop trust. And, there still is a lot of hesitancy out there, and a lot of it has to do with misinformation. And I think just continuing to educate and build trust is so important.
Trust is the big word, Karen. Developing that level of trust with people so that they can trust you to look out for their best well-being is what it's all about when we're talking about making certain that women have quality access to care. It's a level of trust that only women can develop on behalf of other women. So I challenge all of us to make certain that we're developing those relationships that are centered and focused around trust.
Yeah, and quality is key. And I think, again, some of the health centers that we work with and where our patient navigators work out of, the first thing a lot of the leaders of those organizations will tell me is that when their patients come through the door, they want them to be treated with dignity and respect. And I think that that's so important, and that whatever barrier or challenge they're facing, to trust that, this organization is going to help them get through this and maintain that level of dignity and respect that I feel is so important, because a lot of these things are so difficult to talk about. And they could, it could be as a result of, pride, not wanting to discuss a specific topic, which I think why it's so important that we have someone like a navigator or an individual, like Tammy said, at an established medical home that they can go to and talk to you and trust that this person's going to help them get through this while, maintaining their sense of dignity.
Sure.
Have either of you noticed any resistance from recent immigrants to access medical care because of their fears of filling out paperwork and being, undocumented, or even if they're here on a visa, that they're fearful that if they are accessing health care, that it might be a negative when they're trying to apply for residency or something like that?
Yes, we have. We've found that to be the case in this community, but we worked really, really hard to let them know that even though they may be an immigrant, they still have access to the care. And we want them to feel welcome with coming to our federally qualified health centers to receive that care. A lot of them are frightened because they are undocumented. But we let them know that just because of your status does not mean that you do not have the ability to receive quality health care. So we're trying to navigate that. We're working with our leaders within those communities and within those populations to develop those relationships. It's all about trust. They support their individual leaders in their community. So we work through their leaders to make certain that they have the accurate information so that they can continue to access those services.
Great, thank you. When we talk about the cost of healthcare for women, we must recognize that abortion access is healthcare. Multiple studies indicate that the inability to afford abortion care places pregnant individuals further into poverty and harms their health as well as the well-being of their current and future children. Many people lack the means and access to decide whether to continue a pregnancy, and limits on federal funding for abortions cause significant harm to low-income people, in particular communities of color, LGBTQ plus individuals, and residents of rural areas. Jessica, I know you have already shared a lot about Emma's financial support of women who are in need of reproductive access. Is there anything else that you want to share about this cause and about healthcare and abortion access?
Sure. I could go over what kind of a typical day may look like. Like I said before, some individuals may not know they're pregnant. That includes adults, and we also serve minors. So we may get a call on a Tuesday afternoon that a parent brought their minor to the clinic. They found out they were pregnant. They're beyond 15 weeks, and they made an appointment out of state for Thursday. So that's a very quick, less than 48-hour turnaround time. So you have that minor missing school, you have that parent missing work, and not knowing how they're going to come up with the cost either for the procedure or the flight. Additionally, we do serve folks that don't have IDs. And so then that's another barrier that they're going to have to go get an ID in order to be able to fly. We have served people that have never flown before, so this is their first experience ever on an airplane. Again, due to lack of transportation within the community, sometimes people haven't ever been in a ride share before, so they don't necessarily feel comfortable using Uber or Lyft, or we have to help them navigate downloading those systems to their phones, even if they even have a phone that's a smartphone, to be able to use those. Some folks have also not left their communities to stay in hotels. So there's a lot of there's the financial piece, and then there's the educational piece along the way. We are small enough that we don't have patient navigators per se, so it's mostly myself and a case manager that is helping fill the gap for the individuals we serve, both financially and educationally. Again, going back to flying, we've had people who I said haven't flown, but to also try to navigate TSA. They don't know what to pack. They don't have luggage. When we're sending folks to the north, we're coming out of the winter. They don't have winter coats. They don't have hats, boots, the types of clothing that you would need to go to the north in the middle of the winter. So there's all of these different pieces that go into this, which are intentional barriers to try to discourage individuals from getting the type of care that they need. Because of the Hyde Amendment, there is not federal funding for abortion care for individuals. Some states, Florida is not one of them, does allow Medicaid to cover the cost. Some private health insurances cover a certain portion of the cost, but that can also be limited to the amount of weeks, things like that. And then another aspect that I do want to share is that federal funding in Florida for tubal ligations has just been cut. And that went to low-income individuals that needed that. And as I highlighted, and it's been highlighted by others in this, most people seeking abortion care have children. And this is, again, not a decision that's always made easily. And it's to still be able to have financial security for the family you already do have, the time, the resources available to take care of the children that you already do have. And so when we're looking at this, you really have to see what the agenda is behind this and the concept that this is about, that the anti-choice side wants to talk about, that this is protecting life. We're focused on families who are here, who are struggling, and the lack of care and resources that they already have available to them. So the financial impact to a certain degree is immeasurable. And I would also say that as we go into this 6-week ban, there's going to be more individuals that even when we help them develop the plan, and even when we help provide that financial assistance, some people are just going to say no to this because it just seems too insurmountable. And again, that's an intentional action on the part of our state legislature. So trying to build community around individuals, which has also been highlighted on this call, is important. And just making sure people have quality, sound health information, which is also under attack. So I think all of these different issues are similar to one another because it's all coming from a lack of care, no matter what type, within our communities and inside the state of Florida.
One thing that just kept ringing in my head that I've heard before with that while you were talking is that abortion access will always be available to those with privilege. And this is really going to hurt those individuals. You were talking about ride sharing, getting a ride to the airport, getting a plane ticket, getting to a different state, having access, a hotel room. Like you said, sometimes it's just those barriers are just too large for some individuals to ever even think about jumping over. And then to some people, it's something that they won't even think about. And I think there's a real risk, I remember in reading in, medical history books about sepsis clinics and women going to illegal and backdoor places for procedures. And there's a real concern that that will begin again here in Florida and other southern states. And that will really increase the need for healthcare for those women and possibly death. So I think the risk of some of these legislations to women's healthcare is not being seen by those in power. And I'm hopeful that these types of conversations will increase people's ability to put themselves in other shoes. Again, sometimes we think about it from our shoes and, for those of us with privilege, we don't think that this is going to impact us. And if you put yourself in someone else's shoes, then you're able to see how great the impact is really going to be for others and how it can have it will end up having a financial impact on our community as well. And I don't think that's talked about enough as well. So thank you for sharing that. We have a little over 10 minutes left. If any of our attendees have questions that they want to ask, they can put that in the Q&A. I think right now we just have a comment that says you are all amazing women. So we appreciate that comment very much. While we wait to see if there's any questions that pop up, we are wrapping up March, which is Women's History Month. And April begins Sexual Assault Awareness Month. As I mentioned earlier, I worked for many years in sexual violence. Many Palm Beach County residents are unaware of the free services offered at Palm Beach County Victim Services and Certified Rape Crisis Center. They have 5 locations throughout the county. They're at all of the courthouses, including out in Belle Glade, including South and Delray. And then they have their SART Center on North Australian Ave as well, their sexual assault response team. And in honor of Sexual Assault Awareness Month, on Tuesday, April 4th, which is this coming Tuesday from 5:30 to 6:30, they will have their Field of Hope, which is where they honor the 565 victims of sexual assault that they served over the past year. And if you know someone who has been a victim of sexual assault, you can access free services through the 24/7 helpline, which is 561-833-7273. So please make sure if you can attend that event, if you've never been to the Field of Hope event, last year was the first year that they were able to do it again after COVID. They have survivors of sexual violence there who get to plant a flag and get to see their advocates and supporters. Law enforcement comes out. It's a great event. It's kid friendly. So please support them and check out all of their events that take place during the month of April. Herizon is supporting the Girls Coordinating Council in April as well by hosting a live virtual panel on school dress code. If you've talked to a young girl recently and you ask them how they feel about dress code, they have a lot to say. So on April 26th, which also happens to be Denim Day, there'll be a live virtual panel on dress code. Denim Day is a day where we talk about that no matter what you're wearing, what you're wearing is never an excuse for someone to assault you. It goes back to a case out of Italy where a young woman was sexually assaulted by her driving school instructor. And he tried to defend himself by saying that her jeans were too tight and therefore she must have taken them off herself. And it was his excuse for why he sexually assaulted her, even though she was underage. And again, it just goes back to show that no matter what you're wearing, there's no one ever has the right to sexually assault you. So that's April 26th, and you can see more of the events on joinherizon.org. There's a couple more comments on here. Thank you for sharing great information. April 11th to the 17th is Black Maternal Health Week, which I think is a very important week. I would love to find out more about that. We know that women of color have higher mortality rates during childbirth, less access to care. So Caroline, if you're interested in partnering on anything, please reach out to me. And another person saying, thank you all for sharing. Before we end, does anyone have anything that they want to share, any upcoming events or information?
Holly, this is Tammy. I don't have an upcoming event that I would like to share, but I want us to all, as women, to start thinking about HPV and the HPV vaccine. And then Karen and the Promise Fund and I have had conversations about being more intentional with educating people about HPV and how HPV really is transmitted to women. The reality is the HPV virus is transmitted to women by men. And we really, really need to make certain that people know that, people are aware of it, have information out in the community about HPV and what the vaccine is, and encourage people to really, really start thinking about that. It may be an opportunity for us to begin engaging men in this conversation relative to HPV, because the reality is it's them that pass it along to the women, and the women are the ones who are left to deal with it and the cancers that it creates within the female body. So I like for us, if we can make certain that we're putting that conversation, that topic of conversation on the burner, so that we can get that information out into the community.
That's great, Tammy. Thank you so much for sharing. I think it goes back to sometimes we isolate topics as women's issues, when in fact these are human issues and healthcare issues and things that everyone really needs to be talking about and thinking about. And it's not just the burden of women to have the HPV vaccine, and it's not just the burden of women to think about healthcare and abortion access. It's up to all of us. So I appreciate you bringing that up.
And then
Thank
the
you,
last
Tammy.
thing that I would like to just really, really talk about, and this is something that everybody all around the country is beginning to have these conversations, is mental health. And we would talk about women's health care, and we're talking about the inability to access abortion services. Just think about what that looks like on the mental psyche of women. And that's something we're going to have to deal with as a community, as a state, as a country for years and years to come, if we do not get our arms around this and begin to address these issues that women are having relative to their health care as quickly as we can.
Yeah, May is Mental Health Awareness Month, and get your green on. Here at Herizon, we're doing a panel on girls' mental health for parents. I don't know if you've seen the CDC numbers, but here in Palm Beach County, over 50% of our high school girls reported feeling sad or hopeless for at least 2 weeks within the last year, so much so that it interfered with their daily activities. there is a mental health crisis for girls in our community. So that will be a panel for parents, and we will have resources on that panel to speak about free services for girls in our community. So please go to joinhorizon.org to learn more about that. And I would love, Tammy, to do something about women's mental health, because I always say, like, I don't even know of the services that are available for women when it comes to mental health that are free or low cost. And I would love to kind of have a panel about that and talk about women's mental health.
Yeah, that's so important. And, it's something that we've placed also as a priority. And part of, our focus this past year has been actually, Holly, finding services that are covered, for the individuals that we serve. So we'd be happy to share that information with you.
Great, thank you. This is all about what it is, collaboration, because we all have our little areas that we're aware of services, and the more we speak about it and talk about it, the more people are able to access those services. So thank you again all for joining us. Like I said, this has been recorded. It will be available on the Herizon YouTube page and our Facebook channel. So please follow along, joinhorizon.org for more of our upcoming events. And to our panelists, thank you so much for coming on, spending your time with us and sharing this information. It's been very helpful to our community.
Thank you, Holly. Thanks for moderating.
Thank you.
Thank you.
Have a great day. Okay.
Bye-bye.
Bye.